To date, we have also added Wheatland County to the province's watch list. Alberta now has 4 regions coded in blue for watch status. We are monitoring these regions closely, and no additional health measures are being implemented at this time. I am sad to have to report an additional 2 new deaths, including one linked to the outbreak at the Misericordia Hospital. My heart goes out to all those who have lost loved ones during this time, whether to COVID-19 or any other cause. I know that many are concerned about the outbreak at the Misericordia. This outbreak currently has a total of 49 cases, with 17 active patient cases in hospital and 17 staff cases which are currently active. Sadly, there have now been 6 deaths associated with this outbreak. There are multiple measures in place to keep staff and patients safe, and an evaluation of how the spread happened is underway, so we can be sure to learn and apply any lessons from this experience. This is a challenging time for any public health response. The virus has now been in Alberta for 4 months, and while we saw cases decline from the peak seen in April, our daily cases have begun to rise over the past few days. Much of the public advice that we have been providing, including regularly washing your hands and physical distancing, has been repeated for months now. This pandemic has been a long haul, and I worry that Albertans may be starting to tune the messages out. It can seem like old news, and many are tired of hearing this information. As the Premier and I both mentioned yesterday, we are concerned about the recent rise in cases we are seeing. Also of concern is the younger age of people infected with the virus. Over the past 2 weeks, 780 new cases have been identified in the province, with 57% of these cases being under the age of 40. Of these, 30% have not yet been linked to any known source. This is a reminder that COVID-19 can spread quickly, and cases can rise rapidly if we don't all do our part. The best way to defeat the virus has not changed. Stay 2 meters apart when you can, and wear a mask when you can't. Wash or sanitize your hands. Stay home if you are sick and get tested. It's also critical to respect the limits for cohorts. A maximum of 15 people outside of your household for family members and friends, up to 50 for sports cohorts and performers, which are cast members and crew. It is also important to remember that sports cohorts of up to 50 people should not interact with other cohorts. Now is not the time to plan or arrange tournaments that include players outside a single cohort. We need to avoid overcrowding in public spaces and social gatherings. That's how we keep our families and communities safe, by following the guidance, not by discriminating against fellow Albertans who also are doing their best to follow public health measures. So I want to be really clear about the expectations for bars and restaurants, which is that distancing between tables would remain in place. So each table can have no more than 4 people at it, and tables need to be 2 meters or more apart from each other. So while there's no maximum number of people that can be present in a given location, there still are requirements for distancing between tables, and again, that maximum number of people who are going to be at any one table. It is our recommendation that people who are going to restaurants together and sitting at the same table who are not distanced from each other would be members of the same household or cohort family. With respect to any additional restrictions for people who are gathering to watch NHL games, the same restrictions would apply. Again, 4 per table, 2 meters between tables, and while there again is no maximum number of people, it's the distancing between those small groupings of 4 per table that continues to apply.